My name is Kyle Kohlhoff. I'm currently the Pharmacy Support Supervisor here at CHAS Health, which is the lead pharmacy technician inside of our pharmacy. So a pharmacy tech is there to be the advocate for our patients. And in the healthcare system, it seems like that kind of gets lost in the shuffle a lot, and that's one thing that CHAS really pushes for, is for us to be the voice of our patients and helping them in their healthcare journey. So I started in high school, actually. I always wanted to be a pharmacist. And so when I graduated high school, I started looking into programs to try to get my pharmacy tech license to start as a pharmacy assistant. I found a long-term care facility that offered a program to do that, so you get paid to get a license as opposed to having to go to school and pay somebody else for that certification. I started doing that in 2007, received my license in 2008, and have been working as a pharmacy tech ever since. Wanted to pursue going off to be a pharmacist, but I love where I'm at. I love that you can be as outgoing as you want to be with being a pharmacy technician, and the patient interaction is astounding. So CHAS offers that pharmacy tech apprenticeship program. It's a year-long program where pharmacy assistants work one-on-one with pharmacists and their fellow technicians to advance their career, work towards getting their pharmacy tech license. They spend once a month taking tests to advance in their program, and then at the end of that program, about 8 or 9 months in, they're going to take what we call our CHAS final. It's just a test that shows that they're qualified to take the national certification. Over the course of the last 3 months of the program, they go to what we call PTCB, which is Pharmacy Tech Certification Board, and they take the national exam, become nationally certified, and then when they're all done with that, they get licensed through CHAS. They have a 2-year commitment afterwards to basically have a guaranteed job, and yeah, it's a wonderful program that I've seen so many people go through, and it seems to be fantastic. You get paid your full-time wage. It depends on what hours you wanted to work. Sometimes we have technicians that work 4-10s. Sometimes we have technicians that work 5-8s in case that works better for their schedule. It is typically between themselves, their lead pharmacist, and their lead technician what that schedule looks like. But at every clinic that we have, the supervisors are more of leaders, and they try to promote what works best for their employees so that they can keep their employees wanting to come back every day. So a normal day in the life of a pharmacy tech is we start the morning by getting everything ready for the patient's view. We want to make sure that everything is clean and that we have, we want you to want to come to our pharmacy. We don't want it to be a place that you look at and think, oh, okay, I'm not coming back here again. That kind of starts first thing in the morning. Then we move into filling our prescriptions for patients that have either called in their prescriptions ahead of time, doctors that have sent in new prescriptions, whether it's our providers or providers from outside of CHAS. Moving forward from there, it's about counting those prescriptions, getting everything pulled, making sure it's ready for a pharmacist to verify that we've done the right medications, that there's no interactions, so that we can push it more towards the end of our workflow, which is going to be helping the patients at the counter get their medications that they've called in or that we've already had previously ready. A lot of it is direct patient care. It's a lot of answering phones, making sure that we're getting what the patient is calling in and looking for. It's also helping them at the counter. At our pharmacy, we have our drive-through, so it's that as well, and being able to connect with our patients on a more personal basis than I feel a lot of healthcare is able to provide these days, and it's something that as a technician at CHAS I love to death. I get to connect with my patients on a way more personal level than what I was previously able to. And it's just wonderful to get to know a little bit about their lives, even if it's just brief.